Hey, Dr. Z over here. So prior to doing any Prolo, PRP, stem cell exosomes, whatever we have decided, 5 to 10 days prior, you have to be off any type of anti-inflammatories. So whether it's aspirin, Aleve, Advil, naproxen, ibuprofen, Motrin, Excedrin, meloxicam, celecoxib, you want to be off of these medications for at least 10 days prior and at least 10 days afterwards, okay? When it comes to prednisone, or if you're on prednisone or any got any cortisone injections, usually I tell patients at least 3 to 4 weeks prior you want to be off of it, okay? Before we can actually start treating you, okay? The other thing is with curcumin, if you're taking turmeric, which is curcumin, I tell patients to calm down on that one as well. Afterwards, you do not want to do anything heavy for at least 5 to 10 days afterwards. Any exercising heavy, anything like that. Because remember, as we discussed about that goo being formed, when you cut yourself, that goo, we want that goo to settle so you can form the matrix so you can get back your natural, let's say, your skin. Okay, the same thing we're trying to do, whether we're doing Prolo, PRP, or stem cells. We're trying to do the same thing. So for the next 5 to 10 days, you want to take it light. Just do walks, nothing heavy, nothing extraneous. You can do swimming, but nothing extraneous. No cricking and cracking, so no chiropractic manipulation, so HVLA, anything like that. You can do some massages. You can do some heat, no ice, okay? Heat, so you can get capsaicin HP, which is a cream that creates some heat, and you can put it on the area topically. But once again, no ice, okay? I always tell patients is that ice is only good for acute injuries, which is from 3 to 5 days, okay? After that, you want to avoid ice. So rest, ice compression, elevation, that's only good for the first couple of days. What you want to do is meet. So you want to move the area, but this is, remember, after the first couple of days. Do some exercise, so which is physical therapy exercises and whatnot, to strengthen the area. ACE analgesia, not anti-inflammatory, analgesia, which is Tylenol, okay? You can do some analgesia. And TEASE treatment, which is Prolo, PRP, stem cell exosomes, okay? When it comes to stem cells, remember they're like seeds. Remember we're discussing those grass seeds. So those seeds, it does take a couple months to kick in. So I tell patients 3 to 6 months is where it's going to be coming about, where you've noticed the most bang for your buck with it. Some patients within a couple weeks, a couple days actually, patients start noticing things. But I tell patients you got to give it at least a couple months, 3 to 6 months. So I tell patients you want to do things lightly, move the area at least for a month, do things kind of lightly, and not to aggravate the area too much. You want to allow it to settle and let those seeds, in a sense, bear, okay? If you have any questions, you're always free to call my office and whatnot. All right, take care. The other thing I forgot to mention was cupping. So cupping is really good as well. You can get a cupping set easily for like 25 bucks or 30 bucks online. Creates like a vacuum suction, so you'll get these big round marks, and you've probably seen a bunch of athletes with this. That's perfectly fine to do. It stimulates a lot of blood flow to the area, which is what we want.